Unit 211, respond priority 1 to 914 Greenvale Road for an 80-year-old female, altered mental status, possible stroke.
This sounds like it could be a stroke. We'll do good neuro assessment and transport as soon as we can if that's the case. TIA, stroke, diabetic, heart attack, GI bleed, but I think stroke. Hi, we're EMS. We're here to help. What's going on?
Hi, Grandma was making coffee and all of a sudden she started not being able to feel her side very well. She's feeling really weak. She's having trouble speaking. Please come inside. She's really scared.
Okay.
Thank you. Thank you.
All right, Steph. You grab a quick set of vitals and blood sugar. I'm going to talk to the patient and the family and see if we can figure out what's going on. Hi, ma'am. We're from EMS. We're here to help. Did you fall down? Right, I've got her breathing is normal. Her pulse rate is fast and irregular. And her skin is warm and dry. Ma'am, did you lose consciousness at all? Does it hurt anywhere? Onset is 30 minutes ago, so mark onset at 17:30. Ma'am, we're here to take care of you. It appears that you're having trouble speaking and using your right arm, so we're going to ask you a bunch of questions to see what's going on, okay? If you could put up and down for yes and side to side for no, that would be great. All right. No, it's normal to be confused and not be able to use your words. We'll help you communicate with us. Does her face appear normal to you? I'm noticing a slight droop. Have you ever seen that before?
No, that's new.
All right, ma'am. I'm going to need you to squeeze my fingers for me. Can you squeeze my fingers for me? All right, squeeze my fingers. All right, and can you hold your arm up for me? All right. We've got strong activity on the left side, less so on the right. I'm going to check her pupils. Left pupil's dilated.
Pulse is 93. Blood pressure is 170 over 100. Respiratory rate is 20. Oxygen sat is 90. And blood sugar is 90.
Her BP is high, which can be expected because she's probably had a stroke. Her sat levels are low, so we need to get oxygen on her via nasal cannula, 6 liters, and we'll get the cot ready. Do you have a list of medications? And can you tell me about her medical history?
She has AFib. She stopped taking Coumadin 2 days ago. She's scheduled to go into surgery in a couple days. I have her medication list. She's on Cortisone and Diltiazem.
All right. Does she have any allergies?
No allergies.
Great. We've got a patient. She's awake. Positive stroke scale. She's got right side weakness. And is expressively aphasic. We need to get an EKG on her as soon as we get in the ambulance. It's looking like she's in AFib, irregular. We're going to need to bring her to the stroke center quickly. All right, ma'am, how are you feeling now? Okay, we're on our way to the hospital. I'm going to do a quick stroke assessment before we get there. Steph, if you could grab another set of vitals, that would be great. All right. And if you could squeeze my hands. Just squeeze my finger there. All right. And then hold your arms up.
Blood pressure is 180 over 106. Pulse is 86 and respiratory rate is 24.
I'm going to call medical control, let them know the situation. The stroke center has been notified and they're prepping the CT. As soon as we arrive, we need to get our equipment off her as fast as possible and get her into CT. Steph, I'm going to get her on the monitor. Go ahead and start an IV. Alright, I need to put these stickers on you. It's going to help us take a picture of your heart. Alright, ma'am, I'm going to need you to stay really still. I'm going to take a picture of your heart. Alright, she's in AFib with a rate of 110.
Alright, you're going to feel a little pinch. IV is in.
Alright, heart rate is 110, respiratory rate is 20, her sats are at 95. Regional General, this is Unit 211. We're en route to your facility with an 80-year-old female. Patient has had a stroke, onset 1 hour ago. She has right side weakness, slurred speech, and facial droop on her right side. Patient has a history of AFib and was taken off Coumadin 2 days ago. Patient is on oxygen. 12 lead showed AFib. An IV has been established. Current vital signs are her pulse is 110, her blood pressure is 190 over 108, her respirations are 20. Our ETA is 10 minutes out, and the stroke center has been alerted. Do you require anything further? All right, ma'am, we're at the hospital now. They're going to be able to run some tests and look after you.
CT is waiting for us. Let's get her loaded.